everyone, welcome. I'm Sonal Mehrotra Kapoor. You're watching Health and Wellness Myths and Facts. The pandemic has put mental as well as physical health and wellness into sharp focus. Awareness of health issues is important for the visibility and community as well. As the Omicron variant sweeps across the world and the number of cases start to go up, we are still not sure how it might change the course of the pandemic. People with chronic lifestyle conditions like diabetes and heart diseases should be extra careful about it. Diabetes, with its attendant acute and long-term complications and the myriad of disorders associated with it, is a major health hazard, and it is in keeping with the scenarios of most developing countries. India has long passed the stage of a diabetes epidemic. The problem has now reached pandemic proportions. Now, diabetes myths led to greater stigma and, more significantly, misunderstanding and misdiagnosis as well in several cases. Myths prevailing about diabetes in society have also become a major hurdle for its proper treatment and control. Expert advice will help all of you to garner correct information and act accordingly. Joining us on the broadcast today as experts for today's show, we've got Dr. Varma joining us. He's the DM endocrinology consultant, endocrinologist and diabetologist at Harsha Diabetes and Endocrine Clinic in Bhimavaram. And also with us is Dr. Thakkar. He's the MBBS MD physician and a fellow in diabetes, diabetologist and metabolic physician, AHC Diabetes Clinic in Ahmedabad. Let me take the first question to Dr. Varma. Dr. Varma, COVID-19 vaccine choices are getting more complicated. What's the difference between COVID-19 booster shot and a third dose, would you say? And are people with diabetes eligible for a booster dose?
Yeah, good afternoon all. There is a little confusion regarding the nomenclature that we used for these vaccines. The basic difference is that any vaccine, it depends on what context we are giving it to the patient and at what the patient immunostatus is that. So depending on that, we can call it a third dose or a booster dose. Basically what vaccination does, it prepares our body to fight against the eventual occurrence of COVID disease. So once we take the prescribed 2 doses of vaccination, we build up some amount of immunity in our body. But as time passes, this immunity decreases, say for after 6 months or 9 months, depending upon the vaccination. So normal population, they do require some booster dose after this duration of time to increase or maintain their immunity. But if you see some populations like immunocompromised individuals, like patients who are on dialysis or on cancer therapy, they have low immunostatus, and these individuals, even after 2 doses, they will not develop sufficient immunity in them. So those patients, they require additional doses, say 3rd dose or 4th dose to maintain their immunity. So that is the basic difference between the two. And if you see diabetes, it is a comorbidity, and according to our recent guidelines that we get, diabetic patients of more than 60 years duration, they do require booster doses.
They do require a booster dose. So that is the recommendation coming in over there from Dr. Varma. Let me take the next question to Dr. Thakkar. The most accepted and commonly used method for diagnosis of COVID-19 variant is the RT-PCR test, said to be the gold standard there, Doc. But does this test also detect the Omicron variant? And if you could also tell us what extra precautions people with diabetes and heart diseases should be taking to prevent any sort of complications arriving out of Omicron.
Good afternoon, everyone, again. And definitely it's a valid question. Any variant just is the mutant state of the virus, which changes its shape and structure to be more powerful. But the genetic material remains the same, and RT-PCR is the gold standard diagnostic test for many of the diseases like dengue, even chikungunya or influenza, but definitely it is gold standard till now for COVID-19 as well. So it will remain the same for Omicron variant because it is just the mutant state of that virus. and it is going to be there as a gold standard diagnostic method for COVID-19 as well. So people with diabetes and cardiovascular disease are always at higher risk of developing infections, all kind of infections, and Omicron spreads quite faster than any other variant of SARS-CoV-2 virus. So it is definitely more transmissible. So they need to be a little more extra careful for routine hygiene protocols, and avoidance of that large gathering is also very important.
See. I see. Thank you so much, Doctor, for that. Let me go back to Dr. Varma with the next question. Dr. Varma, is the Omicron variant more dangerous in terms of its effect on the health of people as compared to Delta variant? And does it spread faster than other variants as well? I believe much has been written about it, but still we do not have anything concrete to go by.
So like we should understand primarily that this variant is say less than 2 months old. Like we have known this only since November. So the data that is available is very limited in this, and 2 months for a virus is a very short duration of time. So we can't exactly say whether this is more dangerous than the previous Delta variants. It is true that the studies have shown that it is more transmissible and it spreads more rapidly than the other variants. And that we have seen also practically in our country since the last few days, the cases have been increasing at a rapid rate. But one good news in this front is that there are studies from South Africa which have shown that even though the spread is more rapid, the severity of disease is very less. In fact, one study has come out last week which has shown that Omicron causes 80% less hospitalizations as compared with the old Delta variant. And similar studies have come up from UK as well as Scotland also, which have shown that the severity of the disease or hospitalizations because of disease are low. But still, these are early days and we should be careful regarding this. But it appears that it might not be as dangerous as the old Delta variant.
I see. All right, thanks for that. Let's take the next question to Dr. Thakkar again. Do the commonly followed COVID-19 protocols like hand sanitization, masking be as effective against Omicron variant as well? And are there any specific precautions that people need to take, especially those with diabetes?
Definitely, routine hygiene protocols like hand sanitization, routine masking, they should be followed with a little extra care. Like we should ideally wear the mask of a N95, but this only won't work because it is a more transmissible, more aggressive variant, and avoidance of large gathering would be more important in this case. Though hospitalization is quite low, as Dr. Varma has already told us, and that study are there we have already, and I heard yesterday that we had only 59 deaths from this variant in whole world. But for high risk category like people with hypertension, diabetes, heart diseases may get hit very badly if they are not taken care. So on top of that, the patients who fall into category of extra shot or booster dose, age more than 60 and with comorbidities, as well as age between 15 to 18 years of kids and healthcare workers, those they should ideally take that extra shot of vaccine, and they should ideally take it as soon as possible.
Let me take the next question to Dr. Varma now. The key to diabetes, Dr. Varma, and diabetes management is to keep a check on blood sugar and keep that under control. What an extended version would be if you had to explain, say, the ABCs of diabetes to people?
See, diabetes is one of the the disease which we have known since a long time. But previously, up to say last few decades only we have completely understood the pathophysiology of this diabetes. Previously, it was thought that if you get your sugars under control, it is sufficient for diabetes and it is good enough to get a healthy life from that. But the data, as we understand this disease better, it has come to our understanding that not only sugars, there are several other parameters which should be taken care. See, the basic ABCs of diabetic care are nothing but A for HbA1c, that is your glucose control should be good, B for blood pressure, and C for cholesterol. So if these three are under control, then most of our diabetic complications will be taken care of. So this has been known for the last 3 or 4 decades. But now the recent evidence that is coming out has shown that even these three pillars are not sufficient, and we do require other important components. Like not only these three, we require other components like dietary care, dietary education is required, particularly specific to diabetic education. Other also like examinations of your eye or your foot examinations like glucose variability and your proper glucose monitoring also are required for diabetic management. And it's not limited to your sugars alone. The whole holistic approach should be done to achieve a good diabetic control.
All right. So whole holistic approach really to if you want to maintain diabetes, that is. I have another question for Dr. Thakkar. Dr. Thakkar, we saw during the Delta wave at least that people with diabetes most people who did end up in the hospital were those people with diabetes. At the moment in your hospitals with Omicron also spreading like wildfire now in the country, are you seeing more of people with comorbidities and more diabetics in your ICUs?
Diabetic comorbidities, we are not seeing more and more patients hospitalized due to COVID infection nowadays. And in those patients, definitely, even if they are infected with any other variant, so we need to closely glucose monitoring or home blood glucose monitoring, and it is always appreciated. And point of care or insulin dose modification can be done regularly in those patients, or medicinal changes should be done in those patients as well.
All right. So if you are a diabetic at the moment in the country when Omicron is spreading, A, try and get your booster whenever eligible, and B, do stay in touch with your doctor to understand if you need to undergo any changes as well, and see how your medicine routine has to be worked out and your insulin routine has to be worked out as well. On that note, we're going to slip into a break. When we come back, we'll have our experts answer more questions for you. Welcome back. You're watching Health and Wellness Myths and Facts, and we've got our experts answer some questions for you. Let me take the next question to Dr. Thakkar. Now, regular glucose monitoring can help people with diabetes to keep complications of diabetes away. What are the advantages, would you say, of HbA1c testing over glucose measurement for the diagnosis of diabetes, Dr. Thakkar?
Indeed, regular blood glucose monitoring at home by glucose meter is always appreciated and advised for point of care, insulin dose modification, or specific medicinal changes, as well as for hypoglycemia detection. It surely helps in reducing complication rate as well. But HbA1c is helpful for long-term goal, overall glycemic control, and it's also important as diagnostic method which tells average sugar of last 3 months. Even it is useful in pregnancy and diabetes when we want to confirm whether it's frank type 2 diabetes or gestational diabetes and many other conditions. So HbA1c is more useful in long-term goal and trends of glucose status throughout the years every 3 months. But results may be faulty in some hemoglobin disorders like sickle cell anemia or thalassemia or other form of anemia as well. But definitely it's one of the greatest tool for monitoring of glucose control.
All right. Next question. Type 2 diabetes is generally perceived as progressive and incurable by many, but can you put type 2 diabetes into any sort of remission by losing weight, etc.? Dr. Varma, do you want to take that?
Yeah, see, that's an interesting question. Diabetes is usually a progressive disease, and most of our patients they do require lifelong treatment because of this. But we have seen patients, particularly in early part of the disease, if they lose weight, there's a sustained amount of weight loss is present, they can go into remission, which can be sustained for a longer duration of time. Even not only in the early part of the disease, diabetics of say 10 years duration also, with proper guidance and proper weight, they can go into remission. There is data which is available which shows that particularly in early part of the disease, if we lose say about 5 to 10% of our body weight, remission in diabetes can be achieved. But it is important to remember, sir, this is only remission, not a cure of diabetes. Like these patients, they do require a constant monitoring with the regular physician, and they do require constant testing to see whether the diabetes has re-emerged and whether the sugars are again increasing. But it is possible, particularly in obese patients, and also some studies have shown that patients who have undergone bariatric surgery, they have gone into remission of diabetes, and also low carbohydrate diet also has shown some positive results in this scenario.
I see. All right. Abnormal lipid levels also are one of the major risk factors for diabetes and diabetes-related complications as well. Which lipid abnormalities contribute to cardiovascular risks, if at all, to type 2 diabetes people, Dr. Thakkar?
Yes, abnormal lipid levels, they are called dyslipidemia. If some of the parameters of lipid profile like triglyceride is high, then it may be some sort of insulin resistance in type 2 diabetes, and one may be have chance to getting diabetes. But when person with diabetes has high cholesterol levels, it's called diabetic dyslipidemia. And the most important parameter in such patients with high LDL, and a higher level of this LDL in such diabetic patients increases the risk of cardiovascular disease 2 to 3 times higher than normal person. And not only cardiovascular disease, but the other problems like peripheral arterial disease, cerebrovascular stroke, or those patients should targeted to reduce their LDL cholesterol level by 50% from the baseline. So compliance to cholesterol medicine is definitely an important as diabetes and other disease medicine as well. By the way, that we may reduce the risk of diabetes and other heart disease related complications by many folds just by adding cholesterol medicine and have the good compliance to it.
I see. I see. All right. People also adopt, DASH diets because it can reduce hypertension or high blood pressure at times. Most people with hypertension also suffer from diabetes. Is DASH diet safe or an effective way at all for people with diabetes, Dr. Varma?
Yes. See, DASH diet was primarily intended to treat hypertensive patients, but it involves like taking whole grain foods, fruits, vegetables, and decreasing your fat dietary products and decreasing your salt intake. So this is nothing but basically a healthy diet. Like it can be followed by anyone, and even in diabetic patients, it will be helpful. Like taking a proper healthy food is what we require in diabetes. And what this DASH diet does is that it increases our potassium and calcium intake, and it also increases our protein intake, as well as it decreases our fats as well as carbohydrate intake. So basically, it's similar to diabetic diet, and it is one of the approaches that can be done. And the other advantage with this is that it can be followed by every member of the family. Even children can follow this diet, and we don't need much modification. So it is easy to follow in a particular diabetic household. Even if one of the member is a diabetic, the whole family can follow this diet easily, and they will not have any difficulty in this.
I see. Dr. Thakkar, your take on DASH diets?
Definitely, it is meant for hypertension basically earlier. But now the whole idea is to reduce the carbohydrate in our diet, reduce the salt, reduce the sugar, direct sugar, or the simple carbohydrates. It is the basic idea, and this is how we can definitely prevent many of the metabolic disorders. They are preventable.
I see. But talking about diets, due to poor eating habits, also people become deficient in calcium at times. Also, due to working from home and lockdown, we hardly get out, and hence we hardly get sufficient vitamin D. In fact, even before the lockdown, vitamin D is a major deficiency. So, how do calcium and vitamin D deficiency actually affect people with diabetes, Dr. Thakkar?
Definitely, vitamin D deficiency is so much prevalent in our clinical practice. We found that around 60 to 70% of the patients who come and we check their vitamin D3 level, it is very low. It is not just low, very low. Sometimes undetectable ranges we found. Calcium is definitely very important. Secretion of insulin from pancreas, and also it has a vital role to play in contraction of heart muscles as well. Also, vitamin D3 level is associated to normal insulin sensitivity and cardiovascular health as well as bone health. And calcium absorption is directly dependent to vitamin D3 levels. So deficiency of calcium and vitamin D3 is so much prevalent in India. So problem is quite a big. So problems related to those deficiency lead to cardiovascular disease, diabetes, and osteoporosis like condition. So this is why these conditions are so much prevalent in India. And the simple diet like dairy product can be very much helpful, like curd or milk. These things can help us in preventing those deficiency. Also, some of the fruits like banana and many of the fruits that we can take, and they can prevent those deficiency, and we can prevent the metabolic disorders like cardiovascular disease or diabetes.
I see. So dietary changes will actually help you get your calcium and your vitamin D levels back in check. Also, vitamins also prescribed lots of times by doctors to actually bring it back in case you're not managing to sort of do it only with diet. That's all the time we have on the program today. Thank you so much. Have a good day. Keep safe.